Today's recording is based on the idea that we should be discussing privacy more, and we should be talking about what privacy means, and we should be talking about what the legal requirements are versus what is a good thing to do and what is smart to do.
This is the Darshan Talks podcast, regulatory guy, irregular podcast with host Darshan Kulkarni. You can find the show on Twitter at Darshan Talks or the show's website at darshantalks.com.
When we think about it, again, we'll go back to our four major pillars of patient centricity. And the four major pillars of patient centricity are transparency. Number two is the converse of that, which is privacy. The third one is innovation. And the last one is access, i.e., patients want information. They want to make sure their information is private and controlled and in a way that's not just being spread. That they have access to innovations and access to new and updated technologies. And finally, the most important part, which is being able to actually access those innovations in a transparent and private way. So we're only talking about one aspect of it, which is the privacy aspect of it. And when we start discussing that privacy aspect, the most common topic to come up is HIPAA. And it's important to recognize that when you're talking about HIPAA, it's not just the only game in town. There are state laws that also have coverage for health information and privacy associated with that health information. It's also important to recognize that it's only relating to health. So there are non-HIPAA laws that control the privacy associated with that information. The most famous of which right now is GDPR. There's also CCP and the like as well. And the converse of that, which is just because something has health information doesn't necessarily make it subject to HIPAA. And that's actually really surprising to a lot of people. This was sort of interesting to me because I started looking up some information around HIPAA, and I was surprised that IRBs and privacy boards can potentially waive the need for HIPAA authorization in some cases. So just because it is a health-based scenario, and just because it may be even done in the context of a physician relationship, doesn't necessarily mean that HIPAA is always applicable. A privacy board or an IRB may be able to waive that requirement. The next thing to look at is the idea that the information is always available. You have to recognize that if you're doing a study, the information should be the information that is being protected. If you're collecting that information, it has to be focused. It has to be responsive to the study itself. So you can't just go willy-nilly collecting everything you wanted to collect just because it would be interesting. So let's take a step back and let's talk about why this came about. So I had a discussion on Twitter a little bit ago around HIPAA and how health tech companies sort of manage HIPAA versus what is actually required. And I'm not going to name names or anything, quite honestly, because I don't even remember the names. It was just an interesting conversation, and I thought that it's a valid conversation to have. So HIPAA, again, stands for the Health Insurance Portability and Accountability Act of 1996. And so it's one of the first privacy laws that we think of, and people therefore think that it's all-encompassing, it's the broadest, it's the mother of all privacy laws. Just because it's the mother doesn't mean it's the most encompassing. What HIPAA was set up to do was provide the ability to transfer and continue health insurance coverage for millions of people. Surprisingly, it also was supposed to control health fraud and help with managing industry-wide standards for health information on electronic billing and other processes. So the controls came around that. As it relates to privacy, there are other laws that do come into play. There's the common rule. The FDA itself has some controls around privacy associated with subjects. And they're limited, but they exist. And surprisingly, the OCR, which is the Office of Civil Rights, does have controls around it, HIPAA being one of them. So keep that in mind. The other piece around HIPAA is the fact that it's not just one law. It's not just, here's a list of things you need to do to comply with HIPAA. They have the privacy rule and they have a security rule, and they're related, but they're not the same thing. So people will always go, oh, I have all these controls in place, therefore I am HIPAA compliant. No, that just means that you've potentially met a lot of the security requirements around HIPAA, but are you taking all the right steps to maintain an individual's privacy? And those are the questions that start coming into place. So what is HIPAA? The general purpose of HIPAA was the idea that if I go to a physician, go to a doctor, you want to have the information you share with your doctor to be private, and that makes sense. You don't want that doctor turning around and selling that information to the highest bidder in a way that compromises their identity. Now, here's an important question, important consideration: the idea that if you have information and that information does have HIPAA components to it, or at least private components to it, the idea is that, well, then it will never get shared. No, you could theoretically be in a scenario where that information gets de-identified and then it gets shared. That would actually be compliant with HIPAA. There are also scenarios in which that information, even in an identified manner, can be shared, but then all the people associated with it would need to have appropriate controls in place. So just recognize that just because something is subject to HIPAA doesn't mean that it can or cannot be shared. So the next question is, who is subject to HIPAA? So covered entities are subject to HIPAA. So what is a covered entity? Covered entities are health plans, healthcare providers, healthcare clearinghouses, so your health insurance companies and the like. What is interesting to recognize in that is pharmaceutical companies are not a covered entity. HealthTech companies are not a covered entity. So if you are a pharmaceutical company or you are a health tech company, just because someone gives you data doesn't necessarily mean that it's automatically covered under HIPAA. The second piece of that is, if you get the data from someone else, you may be subject to HIPAA requirements because of your business associates agreement. So that's your BAA that a lot of people sign. So a lot of people assume that if you have health information, it is automatically protected health information, or PHI, and therefore you require BAA. No, I could theoretically, and again, I'm not giving legal advice, but I could theoretically create a website and say, people, give me your health insurance. If they, give me your health information. If they give me that health information on the website, if I'm not acting as a physician, that's not covered under HIPAA. So again, there are other laws that may kick into place, things like GDPR. But as a general rule under HIPAA, that you aren't necessarily subject to HIPAA. So the most common misconceptions: this only applies to data directly or indirectly from covered entities. So, well, it's not a misconception. It's actually, this only applies to data that came to you from a covered entity. So therefore, if the data did not come to you from a covered entity, like from a regular website, you would not be covered under HIPAA. Just because it didn't come from the doctor or a covered entity doesn't mean you're exempt. So it could have gone from a covered entity like a doctor to another person to you, and you're probably in that chain and therefore would be covered under HIPAA. Conversely, just because it's health information doesn't mean it's not automatically protected, like that website example I just gave you. So keep these scenarios in mind, and if you need, again, reach out to me. I'm happy to talk to you to explain what some of these situations might be and whether you need to be covered or don't. The next question to think about is, well, so does that mean I'm safe? You've got CCPA, GDPR, the Indian Privacy Act that's being proposed, state laws, all of which could cover patient privacy. There are specific laws, for example, around disease states, like AIDS has state level laws that will say that you need to maintain certain privacy requirements that are different from the requirements for HIPAA. So keep that in mind. Can I be HIPAA certified? I see this a lot. I see people saying, oh, I'm dealing with this company and they're HIPAA certified. There's no such thing. You can't be HIPAA certified. What you do get, and I've worked with these organizations, and they're reputable. What you get is basically a third-party vendor that says, we will come examine your processes. We'll audit those processes, and we'll say that you meet these standards. So this way, if you have 50 people who want to go look at your certification, they can just come to us. We'll share what our requirements are, and that we'll certify that you meet those requirements. That doesn't mean you're HIPAA certified. That just means that you meet the standards this organization has, and those include HIPAA. But you can sort of, if OCR comes and audits you you can go, well, we have this documentation. That doesn't mean anything. It just means that you've tried to meet those standards, and that might be helpful, but it's not the overarching argument. What about all these other certification agencies that I see? Does that mean I'm covered? Like we just expressed, it's part of the story. It's not the full story. There are more bits of information that they're trying to cover. If you're processing, for example, credit card information, there are other laws that come in. If you are just collecting information willy-nilly for sales reasons, there are other laws that come in, whether it's CCPA or GDPR, et cetera, et cetera, et cetera. So stay tuned, listen in. If you have questions about HIPAA, about high tech, how it applies to you, feel free to reach out. Hopefully I'll be able to provide some answers. Otherwise, I can find out those answers for you. Stay tuned.
This is the Darshan Talks podcast. Regulatory guy, irregular podcast with host Darshan Kulkarni. You can find the show on Twitter at Darshan Talks or the show's website at darshantalks.com.